Imagine discovering a serious health issue before it ever causes you a moment of concern or shows any outward signs. It might sound like a superpower, but for cervical cancer, this is precisely what modern medicine aims to achieve, offering a profound advantage in protecting your health. Doctors find cervical cancer asymptomatically, meaning before any symptoms appear, primarily through routine screening tests such as the Pap smear and the human papillomavirus, or HPV, test. These powerful tools are specifically designed to detect cellular changes or the presence of the HPV virus itself, often many years before any cancer actually develops or causes noticeable issues. The core reason this early detection is possible lies in how cervical cancer typically progresses. Almost all cervical cancers are caused by persistent infection. With certain high-risk types of HPV, this virus can cause abnormal changes in the cells of the cervix, known as precancerous lesions, which develop very slowly over time. The Pap smear collects these cells from your cervix to examine them under a microscope for any abnormalities, while the HPV test specifically looks for the presence of the virus that can lead to these changes. By identifying these changes early, doctors can intervene to prevent cancer from forming at all. To benefit from this life-saving screening, you will need to schedule regular appointments with your healthcare provider for a gynecological exam. During this visit, your doctor or nurse will gently collect a sample of cells from your cervix using a small brush or spatula. This quick and usually painless procedure takes only a few minutes. Following the collection, the samples are sent to a laboratory for analysis. Your provider will then discuss the results with you and recommend any next steps if abnormal cells or HPV are found, such as closer monitoring or a simple procedure to remove the precancerous cells. What is particularly remarkable about cervical cancer screening is its preventative power. It is not just about early detection of cancer, but often about preventing cancer entirely. Regular screening allows for the identification and removal of precancerous cells long before they ever have the chance to become cancerous. This proactive approach significantly reduces the incidence and mortality rates of cervical cancer, transforming what was once a leading cause of death for women into a highly preventable and treatable condition, thanks to consistent and informed care. Embracing regular cervical cancer screenings is one of the most effective and empowering steps you can take for your long-term health. By consistently undergoing these simple tests, you are not waiting for problems to arise, but actively safeguarding your well-being, giving yourself the best possible chance to live a full and healthy life, free from the worries of this particular cancer.